My name is Ellen. I'm a PhD student here at Arthritis Research Canada, and I'm also practicing as a physiotherapist. Artificial intelligence, AI, has been trained off of a lot of information, not all of it being correct, but it allows you to learn and really opens doors to have better conversations with healthcare providers.
My name is Gabrielle and I live with rheumatoid arthritis. It took me about 3 to 4 years to be diagnosed. At first, I felt a little discouraged because I realized that I was going to be living the rest of my life with a condition. I was really lucky that I have really supportive parents. Specifically, my mom, she knew that something wasn't right and she really pushed for me to keep going to see doctors. So I think there was that sense of relief with a diagnosis. We have that stepping stone. I think being a university student, it was definitely hard feeling like I was falling behind, but like it wasn't because I wasn't smart enough, it was because like my body just couldn't keep up with it. My biggest struggle in the day-to-day is still just that fatigue. I've been a cheerleader for 13 years now, and it is hard on the body, but it's also really important for me to keep my body moving. When I think about artificial intelligence within healthcare, I think not only about it becoming something that's super efficient for practitioners, I think it can increase a level of autonomy for patients as well. It's a way for that information to become more digestible.
From my conversations with patients, I've heard that some of them have used AI to actually help them interpret blood work results. I think it's really empowering. I am taking the initiative to learn about my condition and use that to have better conversations with our healthcare providers. Artificial intelligence, it's unique because of this kind of generative aspect to it. We call it generative because it gives us responses that are truly novel, that are unique, that are one of a kind. Every day you will hear that there is a new interface with artificial intelligence. I personally don't have one that I would go to versus another. I only like swimming. Can you provide me with the nearest recreational center that has a pool? Provide me a list of things I should be packing before I leave the house. Those are all things we can then use to take the mundane out of our day to free up more cognitive load.
How I like to think about it is you're explaining to like someone who's never heard of this idea before, so you want to give as much context and information as possible.
The more details you provide, the more context you provide, the better your responses will be. You give it that persona and it will provide a better response. If you're a little bit more polite to AI, it will likely provide you with a better response. Crazy. It also has cognitive bandwidth. Maybe worth asking the same question using the same prompt twice. So there's a lot of work to do in terms of privacy, security, confidentiality, even things like environmental impact. Do I need to provide it my name, my address, my phone number? Probably not. If you're uploading documents, triple check if name, date of birth, personal health number is on there, because you do not want to be including that. So that would be my major tip.
Everyone at Arthritis Research Canada has just been so kind and welcoming. I think being so young, it was a little bit scary at first, but now I think I have the tools to manage it.
I think the most important thing that I hope patients gain is simply being okay with asking tons and tons of questions.